Good afternoon, and welcome to our Retired Educators Association of Massachusetts REAM conversation today about long-term care. We're going to talk about all the things you need to know about long-term care. Before we jump into that and hear from your Executive Director, Karen DiDonato, let's just talk a little bit of housekeeping details when we have some folks signing in here. You'll notice that all participants are in a listen-only mode. And what that means is we can't see you or hear you, but if you have questions, and we welcome questions, please type them into the Q&A feature. That way, if it's something that's specific to you, we can respond back to you specifically, or if it's something that the general group would benefit from hearing, we can stop the conversation and just talk about your question here as well. We do record every one of these webinars. That way you can refer to them later on the REAM website, and you can share these, especially this conversation. Share this with your family, maybe your spouse, simply because there's a lot of conversational points in here that are better to have now than whenever the time comes as you go through here. So you'll also notice this QR code with the cute little dinosaur in it. That is the best way that you can get information about what we're talking about today. So have your smartphone ready, and we'll show you how you can use that QR code here as we go through the conversation and at the end as well. So grab a pen and paper. We're going to talk about a lot of different things today, but again, we are recording this, and we want to be able to share with you. We'll introduce ourselves here in just a moment, but right now I want to bring in your Executive Director, Karen DiDonato, to talk about what's going on in Massachusetts. Karen.
Good afternoon, everyone. Thank you for joining us. We are thrilled that we have renewed our partnership with AMBA. They are bringing through so many new and exciting and educational aspects of the benefits that they're offering us, these webinars being one of them. In addition to that, we held a webinar last month about all the kind of what I consider the fun benefits, all the discounts and everything that you can get on traveling and entertainment and car rentals, etc. And that was very informative, and I know a lot of people love to hear about those and be able to take advantage of them, especially if you're traveling. This month we're doing long-term care, which is a topic that everyone needs to get a clear understanding on the benefits and just how much it can help you, and when you get to a point where you do need more care. I just went through that with taking care of an elderly uncle, and I'll tell you, it's an extremely important topic. Just to let you know, though, we're basically our commitment is to serving the economic and social needs and interests of our membership, and that is you. And we can't tell you how important it is for you to reach out to any of your colleagues, bring in new members, because members are the backbone to our organization. Without our membership, we're not able to provide you with any of these benefits. Our affiliation with AMBA, our advocacy at the State House. I know we sent out a call for action last week, because there was an amendment on the table for the budget to actually try to increase the COLA base. I did put, unfortunately, an update on that in my latest newsletter that it did not pass, but still we had over 104 legislators co-sponsored that amendment. So they're starting to hear us. And the more we can get everybody out there to help contact your legislators and follow along with everything that will help to increase your benefits, increase and protect your pensions, provide you with cost of living increases, because as we know, inflation is taking off. The more members we have, we are in a better position to advocate for you. So I highly recommend you reach out and try to bring in some additional members into our organization. And everything's opening up. Matt attended today the Plymouth chapter meeting down in, I think it was in Hanson. And so all of our chapters are just starting to open up. So we are thrilled about that. And I'll be attending other meetings throughout the state, and hopefully I will be able to meet some of you. So without further ado, I'm going to pass you back to John, who is going to bring you through the webinar. And I hope you find it extremely informative. Thanks.
Thank you, Karen. I appreciate that. And as Karen mentioned, my name is John Green. I work with Association Member Benefits Advisors. I live a little bit north of Houston with my wife, who is a second grade elementary school teacher. And I have spent the better part of my career, as well as Matt, in classrooms working with active educators to help them understand what their retirement years are like. So we appreciate the opportunity to be here with you today, and looking forward to this conversation. And I'll share a little bit about why it's such a personal topic to me as we jump in. But I want to allow our leader in New England, Matt Sargento, to introduce himself and his lovely family, and just share a little bit about yourself, Matt.
Thanks, John. And this picture is just from last week from our family vacation. So I am Matt Sargento. I'm the New England district leader. I live in southern New Hampshire, but I service all of New England, and I partner with Karen and REAM as your benefits advisor. So as Karen mentioned, I was down in Hanson. It was Hanson, Massachusetts today at a luncheon for the Cape Cod and the Plymouth chapter, and it was just really nice. I know that everyone appreciated having the opportunity to get together again. I know it's been some time, so hopefully I'll see some of you out there when I'm out and about at the chapter meetings, and I'm here to help.
Thank you, Matt. Appreciate that. Glad to always be out there. And then both Karen and Matt talked about the value of your association just in their summary conversations already. What REAM does on behalf of retired educators, watching out over that pension. As Karen mentioned, the action alerts, the notifications, watching out for those opportunities that are good, watching out for those opportunities that are not so good, that trying to take away some of the benefits you've earned. But really, as we're coming out of COVID, your association works to connect you, keep you connected to those people that came out of the same education community you did. It's not only good for the education community as a whole, but it's good for your health to get back out there together and to enjoy each other's company. And then to partner up with us at AMBA to offer you important benefits, discounts. Karen mentioned the free passport program, which is the fun discounts. I'll touch on that at the end of the conversation today. This gives you an opportunity to get more out of your membership with REAM. And part of those advantages are they can fill those gaps that maybe you left behind from your benefits, whether it be at the district level or state benefit, something like that. They're portable, meaning that if you leave the state for whatever reason, they're not set with a network. You can take these benefits anywhere. But especially some of the reasons that REAM members tell us they really like having their association with REAM and with AMBA is they can access benefits for their family members, be it for their adult children or for their parents. And this conversation today goes a long way about that, because maybe doing something with your parents can save you a lot of heartache and a financial expense yourself later on down the line. And that conversation is about long-term care and the long-term care insurance arena conversation, those type of things. So just our overall goals today are to talk about the myths and the facts just around care in general. We're going to give you some summary numbers. We're going to share with you some things that are out there right now. I want you to grab a pen and paper. We're going to give you some numbers to write down and just kind of discuss how long-term care impacts families. Karen talked about how she dealt with her uncle. I'll share with you my father's story, and we'll just kind of walk you through some of the components of a traditional long-term care plan, show you some solutions, help you make the most of your options, because there are some options out there depending upon your age and things like that. But to help Matt and I understand who's on the call today, I'm going to launch a quick poll. I want you to tell me what kind of long-term care plans you've made, whether you've made some yes, no, or you're not sure. All you've got to do is just simply answer. It's a multiple choice there, or one answer, and it's anonymous, so you don't feel like you have to share your information, but we would love to have you participate in here, and we'll keep it open for just a few seconds to let everybody get a chance to click on that poll if they want to participate. So. And I'll share with you the reason why that this is important to me is because the last 2.5 years of my father's life, he was in a nursing home as a result of vascular dementia. And because he had prepared, we were able to make sure that he was taken care of in the manner and he earned his respect, his dignity, but also was not a financial burden on my stepmother, my brother, or I. So, all right. So we've got somebody, others haven't chosen to participate in the poll, but we have somebody who has already taken steps with their long-term care plan. So that is great. And we do appreciate that. And we will move on, and that'll help us address that. So whether you answered the poll or not, we're going to talk about some of the steps as you go through here. But I just want to give you a little bit of a history lesson. We may have some history teachers on the call here. Back in the early 90s, long-term care policies became very popular as many active educators watched what happened with their parents, and they saw that there was a need there. School districts and sometimes states stepped up and said, here is an opportunity for you to purchase a long-term care policy. So we saw a lot of teachers buy long-term care policies through a group type setting environment all the way up until the early 2000s. At that point, Alzheimer's really took off, and the cost to provide the care that was covered by these long-term care policies really caused companies to have to raise rates, tighten up guidelines. It made it very difficult to qualify for. And then you start to see this pretty significant decline over the past couple of decades in long-term care coverage. It didn't change the fact that the need was there, but we saw a decline. So we're kind of in this situation that's a good news, bad news situation right now. First and foremost, the good news, advancements in diagnosis and treatment are driving up life expectancies. Remove COVID from it, we're catching cancers much quicker, preventing strokes, those type of things that are chronic debilitators that would cause somebody to need some type of long-term care. Those things are going down. Advancements in diagnosis are improving that. And so you've got much better outcomes. At the same time, the variety of care options are increasing. So used to, I think about my grandparents back in the 70s and 80s, they would either stay at home as long as they could, and then it was all the way to a nursing home. There was never any step along the way. And now we're seeing much more assisted living facility capability, home health care, lots of different options out there, progressive care communities, things like that. That's the good news. On the flip side, however, an aging population is driving up the need and the cost. It's the old supply and demand curve. There is not as much supply as there is demand, so that's driving up the cost. The smaller families that we have reduces that care pool. I think about all four of my grandparents. They were one of either 7 to 12 children. Grew up in farming communities all in the northern part of Texas and southern Oklahoma. And so if somebody needed care, there was always somebody within the family that could take care of you. Now we're having much smaller families, 1 to 2 kids, moving across the country, spread out, less people that can provide care for us. We saw companies started to tighten up language at the same time that Medicare started making changes. Medicare used to provide fairly robust coverage for any type of long-term care. It has tightened it down significantly. We're going to talk about that. Premiums went up, coverages changed, large elimination periods. We'll talk about that. And all of a sudden, COVID-19 came in. And when my father was in his nursing home, when COVID kicked in, I quickly realized how many workers at these facilities, especially the rehab technicians, dietitians, things like that, rotate among several different locations. And COVID shut that down. So that drove up the need for more employees and the cost. So it is kind of a good news, bad news situation, but we're going to give you some numbers to help you can kind of control not only the cost, but the how you can take control of that. So here's where you may find yourself now. If you have an existing policy, and we see this with a lot of teachers, Matt and I review a lot of policies with teachers who took their policies out when they were actively educating. We see sizable rate increases on existing policies. We see some companies saying, hey, we'll offer to reduce the coverage for a level premium. That could be a bit of a difficulty. Or some people are saying, you know what? I had a large elimination period, and don't worry about the term because I'm going to share with you what that means in a moment. And now that I may need this, I realize I don't have the ability to pay for 90 days of my care before the policy kicks in, things like that, or that the policy doesn't match what their current needs are, things of that nature. So, and then some policies don't really provide you with flexibility on where you want to get cared for. So as we go through traditional policies, I want you to think about what you might have. Highly encourage you to have Matt review that with you. That way you can get a good peace of mind in knowing what you have and what you don't have. And that's okay, because what hasn't changed through all of this, through COVID, through anything that's happened in the past 3 or 4 decades, is 70% of us are going to need long-term care or extended care once we reach age 65. And that could be like my father's situation, where he needed it the last 2.5 years of his life, or it could be a fall resulting from, breaking a hip, resulting from a fall, something like that, and needing care for 3 or 4 months. So an overwhelming number of us are going to need care sometime within our life once we reach age 65. But these are the numbers. I want you to write some of these down because I want you to take control over where you think you might be. If you have a policy, or even if you don't have a policy, what this could mean for you. The average amount of time that someone spends in an assisted living facility. Now, this is one of those facilities that's not quite a nursing home and it's not quite staying at home. You still have your own residence. You get to participate in the meals and the activities. But if you need some sort of light housekeeping, you need someone that maybe can deliver meds to you or need a little bit of care along the way, that's the type of facility we're talking about. 28 months is about the average time somebody spends there. Well over half, close to 60% of people who start out in an assisted living facility will ultimately move to a skilled nursing facility, what we would consider a nursing home. So just think about that. 2.2 years is the average time in a nursing home stay. For men, it's about 8 months. Women, it's about 2.5 years. I saw this with the place that my father stayed. He beat the odds, for lack of a better term. Other than his vascular dementia, his overall body was very healthy. So he spent close to 2.5 years in the facility. But I saw many men who were less, and many women who had been there 3 to 4 years. But then I also noticed there were many people in there that had been there 5, 6, 7 years, mostly because of Alzheimer's. Their body is healthy, just the mind does not allow them to be able to live alone and care for themselves. So think about that if you've got a history of Alzheimer's in your family. But the number that jumped off the page in these stats that I was looking up several months ago was that almost half of all nursing home residents stay less than 100 days. So I want you to write that 100 days down because Matt and I are going to show you a figure and show you why here in just a moment, because that number really blew me away when we talk about how long people stay in a nursing home. All right, so let's talk about long-term care. And this could be a policy that maybe you took out when you were actively a teacher, could be a policy that you took out outside of school, whatever it is. This will kind of help inform you about how long-term care policies work. And we're going to put this in the analogy of a hamburger. You build a good hamburger, it's got some basic components, but then it's got some extras to make it customized for you. In a long-term care policy, most policies require you to have a trigger that says your benefits can be activated. So just think about like an auto insurance claim. If you have a car insurance, you don't get paid on it unless there is an accident or a covered loss. Somebody breaks into it, something like that. Same with the long-term care policy. You don't get paid for it until you lose something or have something that causes you not to be able to take care of yourself. Most policies have what's called an activities of daily living requirement that says you have to lose 2 or 3 activities of daily living, such as bathing, continence, transferring, being able to get out of bed into a chair, vice versa, dressing yourself, feeding yourself, or being able to go to the bathroom by yourself. If you lose 2 or more of those and the doctor certifies it, that usually means then that you can go on claim. You can start to claim on your policy. The other component of that is a cognitive impairment, such as Alzheimer's or dementia. For example, with my father, in his early stages of dementia, he could still do all of his activities of daily living just fine. But he was an impairment or danger to himself because he could wander off, or he'd get up in the middle of the night and magically become an electrician. And he was not trained in electrical work at all. So he was a danger to himself, and my stepmother needed to have somebody who could just stay up with him at night so that he wouldn't hurt himself. So a good policy or traditional policy, you either lose an activity of daily living or 2, or you have a cognitive impairment. And then that triggers your daily benefit amount. That daily benefit amount could be $100, $200, $300 a day, or it could be a pool of money that says you have X number of thousands of dollars that you can use for your care until it runs out. Depending upon the type of policy that you have, that length of coverage could be like the pool of money. As long as that pool still has money in it, you've got it. Or it could say you've got the daily benefit amount for 3 years or 5 years. Or in the case of my father, it was a lifetime policy. So if he had Alzheimer's and will live for 15 more years, it's going to pay that daily amount every day for 15 years for as long as he's alive. That's your meat of your burger. That's the juicy part of it. And then you start to add kind of your condiments or your options out there. The first and the biggest that a lot of people overlook is the elimination period. What an elimination period is, it acts like a deductible on your homeowner's insurance policy or your auto insurance policy. In that, like with your auto insurance policy, if you get into an accident, say you hit a deer, the first $500 or the first $1,000 of your claim, you're responsible for. That's your deductible. With a long-term care plan, your elimination period is measured in terms of time. So it could be 90 days. It could be 180 days that you would be responsible for your own care and paying for that before the policy kicked in. Now, a lot of times, the longer the elimination period, the less the premium was. So people would take a 90-day elimination period. I'm going to show you what that could cost you in Massachusetts here in just a moment, but there are some workarounds to this elimination period, and we'll talk about that. The next in these condiments or these options in most long-term care policies are location of coverage. Many policies that are traditional basically will say you can be taken care of if you're confined to a nursing home. Some policies will have coverage for assisted living facilities as well, or adult daycare, or even a home health aide coming to your home. Policies vary. Sometimes they'll cut the amount of coverage. It'd be like if you have $300 a day in a nursing home, it could be that you get $200 a day is home health care. So there's a wide variety of location of coverage that you can get covered for. This can be a big thing. Again, it's important if you have coverage to check where that is. The other comes in terms of inflation protection. As we all know right now, inflation is going up, up, up. It's impacting nursing home care as well. And so it is inflation. You could have taken a policy out 30 years ago or 20 years ago, and now it hasn't kept up with inflation. We'll talk about that inflation because oftentimes in the policy, they will say you have inflation protection at 5% compound or 5% simple, or we're going to offer you to increase your daily amount every couple of years by $50 a day or $25 a day. But if you don't take it 2 times, we're going to eliminate the opportunity for you to take it at all. So you may have some built-in living coverages, for lack of a better term, that you have to exercise. And then finally, and to me, most importantly, does your policy cover non-skilled services? And what I'm talking about here is somebody that can come in and do light housekeeping, or prepare some meals, or possibly just sit up with you like my father did at night so that you're not a flight risk. Not somebody who is a skilled nurse or rehab technician that can help you out, those kind of things. We're talking about somebody that's just non-skilled. So we're going to walk through these things, these components, show you how these work, but also show you some alternatives as we go through here as well. But to really define it, extended care, we have to know that it's beyond what it used to be. It's nursing home care, yes, or a long-term care facility. It's assisted living communities. We're starting to see pop up more what I call continuing care communities, where they could be centered around religious organizations or churches, fraternal organizations. There's even one down here in Central Texas just for retired teachers. There's just a community where you go in with your own residents, and then as you need continuing care up to full-time skilled nursing, you have that. So there's options there. Or first, and most importantly, where most everybody wants to be taken care of is in their home, because you're comfortable there and you want to be around your loved ones, that type of thing. So that's what extended care is. It's not always just nursing home care. And just as many varieties as there are in places you can be cared for, there are just as many varieties in the way that you pay for extended care. Most people will use the first 2 here. They will spend down their personal savings or assets. or they'll ask for assistance from family and friends. And I'm going to show you how that impacts family and friends and how it impacts your personal savings you've worked for. Some will choose to try to go into the Medicaid program. And I can tell you that is extremely difficult. And we'll talk about that in just a moment as well. And then there's the extended care option. So that again means that you have someone else pay for your care because you've set up how you want to be taken care of. Because you don't know what the future holds in store. The older we get, sometimes the less we're able to do things for ourselves. As I saw my father, who ran track collegiately, all-stater in Texas in 3 sports, played competitive basketball up until his early 60s. Most healthy man I knew. A series of small strokes started leading to vascular dementia, where he couldn't do things for himself anymore. Then he was in the facility, and I noticed that there were people in there who were younger than me. And I was in my early 50s whenever my father went into the facility. And so I asked the nurses what's going on. And they would say, these are people that had a fall and had a traumatic brain injury or was in a car accident. So there are some challenges that you never know from an age perspective when you might need care. And then whenever you do need care, it may be too late at that point. So you never know when and what. And these myths that are out there are that health insurance and Medicare covers everything. I can tell you that Medicare and private health insurance, state-provided health insurance, is not contemplating taking care of you on a long-term basis. There may be some rehabilitation benefits for a certain period of time, but it definitely does not contemplate that. Then people talk about Medicare being the same as Medicaid. Medicare and Medicaid are 2 totally different things. We'll explain that in a moment. Don't want you to get those confused. And then people talk about, well, I'm too young to buy. You're never too young to buy. Sometimes we may get too old to buy, to take care of ourselves. But we'll address some of those as we go through here in the myth section. Mutual of Omaha. When I think Mutual of Omaha, I think about Marlon Perkins and Jim out there hunting down African wildebeests and wrestling snakes and stuff like that. This is the company that used to sponsor Wild Kingdom. They are one of the top providers, strongest companies in long-term care. They give us data. And they tell us, hey, this is kind of what to look for. This is what our average claim has been, things like that. Average age somebody goes on claim is 78. For my father, that was spot on when his long-term care policy kicked in. Long-term care users are overwhelmingly more women than men, simply because most of the time, mom will keep dad home forever, and then he passes away and she's worn out and she has to go into a nursing facility because she doesn't have the ability to take care of herself at home. Top 3 reasons for care: dementia. Again, I saw this with my father. Heart disease and arthritis. Arthritis surprised me. So you can see if you've got history of those in your family that you can see how that can happen. But we want to give you these numbers, Matt and I do, because we want you to understand what could be the potential opportunities out there, the potential problems that could befall somebody. And just as there are a wide variety of places to be taken care of, there are a wide variety of types of services provided in the home, in your community, assisted living facilities, nursing homes. A good long-term care policy doesn't mean nursing home. A good long-term care policy can really do some things in your home and take you a long way because it can supplement your out-of-pocket expenses without having to worry about dipping into your life savings. Where we see oftentimes some really sad situations as to where the husband needs the care and they will spend down all of their savings to take care of him. And then there's nothing left for mom after he's gone. So it can protect those assets that you've worked so hard and keep you connected to things that mattered most. It was so important to my brother and I and my stepmother that my dad stay home as long as he could in an environment where he was familiar, as long as he could remember where he was. That was what mattered the most to us. He had a good long-term care plan that allowed him to do that and take care of that. Those stay-at-home benefits are so crucial because my stepmother still worked at the time my father needed his care. It helps with household tasks like cleaning and cooking, helping you get dressed, bathing, things like that. It would pay if a skilled visiting nurse needed to come see him. But the best thing about these benefits for a stay-at-home plan with long-term care is you can use them for home modifications. If you need an adjustable bed, if you need to widen some doors to get a wheelchair through or some ramps in the house or lower some cabinets, things like that, this allows you to do that. It keeps you at home. We never wanted to put my father in a nursing home until it was absolutely necessary. A good long-term care plan allows you to stay at home as long as you want to. It's never made any sense to me for you to work all your life, take care of our kids in school, then to have somebody else determine where you spend your final years. A good long-term care plan puts that control back in your hands. So what does it cost? So Matt and I have pulled up some numbers here. We've gone out to different company, Mutual of Omaha and others. They do long-term care surveys every year. The new survey should be released here anytime next couple of weeks, or if not a month or so from now. But these are the average rates nationally. So you can see for a home health aide, it's about $27 an hour for them to come out to your house. To live in an assisted living facility, about $4,800, and that's usually for a private room. Semi-private nursing homes, about $8,000, a little over $9,000 for a private room on a monthly basis. You can see the impact of inflation over the past decade there. What blew me away was the research that Matt did in Massachusetts. Now, I live in Texas. We're one of the cheaper states. My father's room was probably about $5,500, somewhere in that area, for a semi-private room. Wasn't the Taj Mahal, but it was a very good facility. Loved the staff. He was well taken care of. In Massachusetts, these numbers blew me away. A home health aide to come out to your house is anywhere between $5,800 to $6,600 a month. An assisted living facility in a one-bedroom single occupancy can run between $5,000 to $7,000 a month. Then you look at nursing homes. You're talking $12,000 to $15,000 a month, depending upon the type of room. Now, when my father needed care, I couldn't call his pension board and say, "Hey, can you double up his payments?" So I don't know if you can do that. Matt, can you do that in Massachusetts? Can teachers can't call up that way? Okay. So this is where you can see that this can be a challenge, the expense. So how do you pay? Because when you're hit with that need, when we were hit with my father's first time where he wandered off, and we went to the doctor, and the doctor said he's not going to get better, but we can keep him at home if you've got somebody who can watch him. We had a plan that paid for that. Sometimes the funds that you need aren't available when you need them. And you have to either cash in an asset, sell, trigger something on an IRA or a 403B plan, an asset that you weren't planning, and take a loss or take a tax hit on it. Some people try to go the Medicaid route. I will tell you, Medicaid is extremely last minute or last resort, because oftentimes you've got to go back and look 5 years back to see if you tried to sell some of your assets to make you eligible. And the state usually seeks reimbursement at that point from your estate, even after you pass away. So very challenging to get on Medicaid. I have not yet seen a retired teacher who has a pension qualify for Medicaid, because usually their pension keeps them above the poverty line. So usually people will say, I'm going to rely on my own assets, or I'm going to rely on somebody in my family, because usually that's what happens. Over 70% of us who have a long-term care need are going to rely on an informal caregiver to come to my house for no compensation. And unfortunately, that usually falls on the daughters in the family or the daughter-in-laws to stop their career, maybe take away time from their family to spend time taking care of a loved one. We were blessed. My father had a plan. We were able to take care of him in the manner he desired and that he deserved. Unfortunately, most don't. And so this really impacts multi-generations about how they're cared for. So I'd highly think about that, especially if you have a daughter who's teaching, because if she has to quit her job to take care of you, that could stunt not only her income for the family, but pension money. It could lower her pension in the long run as well. Highly encourage you to take a look at that. What about Medicare? I asked you to write a couple of numbers down. I asked you to write the number 100 down. There's this perception that Medicare pays for long-term care. It used to have much more robust coverage for long-term care. It does not anymore. Medicare will pay for skilled nursing care after you've had, and only after you've had, a 3-day inpatient hospital stay. If you've had a 3-day inpatient stay, and remember that word inpatient, Medicare will pay 100% of the first 20 days of your care. After that, you're responsible for a co-insurance payment. Then after 100 days, Medicare stops paying altogether, and you're 100% responsible at that point. So if you remember that stat earlier in the conversation where we talked about 47, 48% of all people who go to a nursing home, they leave within 100 days. This is why. Because they run out of money, because Medicare stops paying. Then they have to rely on something else for care out there. So that's the sad reality. And what makes it even worse out there, notice I talked about inpatient stay. Medicare changes every year what they qualify as an inpatient stay. You could go in for, say, a hip replacement because you had a fall. You can stay 3 nights in a hospital, get all the care taken care of from Medicare, but if Medicare didn't qualify that procedure as an inpatient stay and just as an observation status, you would receive none of the skilled nursing coverage afterwards. You're responsible for it on your own. Give you the example from my father. My father had a stroke and in the hospital about 5 or 6 days, had surgery on it. He qualified as qualified as inpatient surgery. So he got to go to a rehab facility for 20 days. They were all about getting him up on his feet, being able to feed himself, walk, change his clothes, go to the restroom, all that kind of stuff like that. About day 18 or so, the doctor said, your dad's not going to get any better. At that point, and at that point right there, Medicare stops paying altogether. Whenever that nursing facility determines that you're no longer receiving skilled care, meaning that you're not being able to be rehabilitated to a point where you can take care of yourself, then you go off of Medicare 100%. It doesn't matter if there's 7 days left in that 20 days at 100% coverage, or there's any days left in your 100 days coverage, Medicare stops paying altogether. And that really, really, really can put you at a financial lurch if you're not prepared. The good news is you have other options. Through AMBA, through REAM, you have options that can take care of length of coverage. You can be more economical with that, give you bigger or smaller daily amounts with an elimination period or cover elimination period that you don't have to have any money out of your pocket. The best part about it is you can choose your location. You can have it at home if you want to, or you can have it at nursing home or any of your choice. And you can have non-skilled services depending upon how you want to qualify the policy. So Matt and his team have lots of options for you, more than take care of your need there. So I highly encourage you to talk to him about that. And then we still get some questions. We still get some people say, you know what? I'm still not convinced, or I've got medical conditions, something like that. Are there any other unique ways to pay for long-term care? I'm always going to encourage you to have Matt review your options out there, but I want to throw a couple of them out here to you right now. Some life insurance policies, they have in them a provision that allows you to accelerate a portion of the face amount to pay for your long-term care. So say you have a $200,000 policy, they may say that you can take up to 50% or up to $100,000 to use for your long-term care while you're still living. Once you pass away, then your beneficiaries receive the other amount. One thing that most of those policies say is you have to be confined to a nursing home. You can't just use it for your home care. It's got to be a nursing home. The other is a REAM endorsed tax deferred asset protection plan that allows you to shelter your monies in an account, grow it without any loss potential from a stock market or anything like that, but you can use your money without penalty or double your money if you're qualified for long-term care needs. That's the route I've chosen to go because of the history of dementia on both sides of my family. I don't qualify for a long-term care plan. I've chosen to go this route because If I need the money for my long-term care, I've got it. I can pull it out whenever I need to with no penalty. If I'm already starting to take my money out on a periodic payment and need long-term care, it will double. So it's like I get a pension that doubles automatically. But if I don't need it for long-term care for my wife and I, then I can use it for whatever I want to. So it gives me a lot of flexibility. The other options are out there. If you have a health savings account because you have some earned income, you can use that to purchase a long-term care plan without taxes. Saves you taxes on both ends that way. Some people are already starting to get required minimum distributions from their 403B plans and their IRAs. You can use some of that money, purchase a qualified plan, save some tax money that way as well. And then finally, there are some options because you saw that heart attack, that type of thing, and stroke can be big contributors to long-term care needs. Consider maybe a lump sum plan from a heart attack, cancer, or stroke that could maybe give you $50,000 to use how you want to towards your care. So there's a lot of different options that are out there. You can use this QR code in your smartphone. I'll pull this back up a little bit later as well. If you've got questions, please put those into Q&A. Let Matt and I answer those for you. Matt, before we move on and wrap up this conversation, I know you've done long-term care for many years for many members. What are some of the questions that you get when you're meeting with a REAM member talking about their long-term care plans?
Well, the first question that I get is, how much does it cost? How much is it going to cost me every month? And as John mentioned, there's many pieces of that perfect cheeseburger, right? So they're very customizable plans. So we try to design something that will fit your need. It may not cover everything, but it will give you some sort of protection, to take some of that burden off. But as he mentioned, I look at it holistically, at your entire situation of what you have going on in retirement. And he mentioned, outside of a traditional long-term care plan, there are some other options that can help ease the burden. So the biggest question I get is that, and the other question is, will I qualify? And yeah, these are health and age. A traditional long-term care policy is based on your health and it's based on your age. So that's why we try to find different strategies that can assist our members.
Great. And there are different strategies that some are available for older individuals, older than a certain age. So there's some that have, if you've got health conditions. So there's a lot of different options out there. Highly encourage you. I'm going to show you here in just a moment how you can get a hold of Matt. And but if you got questions, put them into Q&A. We'll be glad to answer those for you. Karen mentioned this. This is your free benefit. This is called the MyAmba Discounts Program. It's the Passport Program that gives you discounts all over New England, all over the world, all over America, that you can save money, make your REAM membership stretch even further. It's Mother's Day coming up. Flowers are on discount out there. Their graduation season. So if you're looking to, buy a high school or college graduate a laptop, a camera, something like that, all kind of discounts out there. If you're looking to go into the city, New York, and to go see a play, travel, so many things are out there. Highly encourage you, get involved with that. Doesn't cost you a dime, but can save you quite a bit of money as well.
John, we did the webinar on the passport last month. If you didn't have a chance to sign up and you have questions on how to sign up, just send me an email and my contact will be at the end, and I'll send you the link to be able to sign up.
Absolutely. We can send you the link to sign up. We can send you the webinar, talk you through it, whatever. Take advantage of it. Again, this is a free benefit as part of your membership. Take advantage of that. Coming up in the summer, as we kick off summer, Matt's going to talk about protecting your nest egg, the 5 biggest threats to your nest egg, and how you can protect that. We're going to talk about emergency transportation up there in New England. Not a day goes by that you probably don't hear an ambulance siren. We're going to talk about what that really costs and how you can protect yourself on that. Talk about financial wellness, getting your financial house in order in August. And then we're just going to kind of do a Life 101 conversation in September, where we just kind of do education about what different life insurance policies are, what they mean, why this season in life you may or may not need one, or what you have. So it's important that you understand that and make sure that you've got what you think you need. So pay attention to that. Look out for emails from Karen and the crew, and that way you can be involved and get registered for that. And please, please, please tell your fellow retirees about this webinar series. If you know of a teacher who's getting ready to retire. Introduce them to the association through these webinar series. It's a great way to show them beyond the advocacy, beyond the community, what the benefits are of being in REAM. So make sure that you do that. And I'm going to wrap it up here, showing you multiple ways that you can get a hold of us. First and foremost, if you have your smartphone available, you can open up your camera feature on your smartphone, hover over that little dinosaur, and a form will pop up. And you can just say, I want to have a benefit review, or I want to know about long-term care. What are my options? Fill that out. It goes back to Matt. Matt will call you. He will reach out to you and can set up a physical appointment, a Zoom appointment, anything like that to take care of you. So again, really simple to do in that regards. But if you're on your smartphone or you're on a tablet and you don't have access to your camera, I'm going to leave up Matt's email address there. That way you can email him and say, hey, here's my phone number and name. Please contact me. That's all you got to do. And Matt, what does that contact sound like? So, I mean, when they call you, what do you leave a message, or how do you contact back out?
I would call you and I would say, this is Matt Sargento, your benefits advisor with AMBA and REAM. Just following up on the information you requested, and we'll set up a time to speak and we can look at your particular situation and I can answer any questions you have that pertain to you personally.
Great. Thank you, Matt. Appreciate that. So I'm going to leave this open for questions. If you want to put questions in the Q&A feature, you can do that. We can address those. I am also going to go ahead and